Hi, Dr. Zach Watkins here. I'm here with Christina Davis, practice manager, and we wanted to share something with you. This is why we're doing it in video format today. But, you know, we have come to a point in practice that we're trying to find ways that serve the community and our patients better. And multiple times when we have patients come through our office and go through sometimes these transformation or restoration plans, you know, at the end, when we're trying to get them to a healthier state, disease prevention and symptom management, if you will, sometimes the question comes up, well, what do we do now? What is next in my journey of health? Because I think you would agree that from a prevention perspective, we don't necessarily live in an absence of disease. We're always trying to be preventative and do what we can through our knowledge to you know, kind of we say sometimes stay out of trouble. Mm-hmm. So, you know, I think from a practice perspective and for myself in general, we really want to serve patients in a way that says we can do more for you. We want to do things that are more consistent. We want to do things that you can count on and expect, so that way we can serve you the best that we can. So I think today we wanted to talk about a few new things that we're going to be starting here at our office that actually have already started, and kind of clarify some things and kind of share what these are. So,
and for those of you that are not actually patients right now at all, are actively seeking services at our clinic, there also might be some ways that this fits better or differently into your life and your family's life, and it's important for us to share that with you too.
Yeah. So what we've talked about and what we are happy to kind of share with people currently is what we're I guess we're calling basically a membership plan for our clinic. And the point of this is we're noticing patients when they're done, there's a lot of benefit that they can receive from further lab testing, from family medicine visits, from, you know, well baby checks, and even to, if you want to call, you know, sick management. You know, you come down with something, you want to make sure that, you know, you're doing things you can from a preventative perspective, not just medicinal. So what we have done, even with patients currently, is that we are offering a situation where we give you a lot of these solutions for your care, for your family, in more of a membership-based type model that we see that a lot of patients are asking about, that they want to do a lot of these preventative, proactive testing, taking care of their family, if you will, on a longer scope of time, but they also want to know, well, what can I expect, let's say, from a cost perspective, a time perspective, and things like that. Would you want to share a little bit about these details?
Yeah, I sure can. And I also wanted to mention just a few things. I think one of the things that our patients have been asking for is consistency.
Yeah.
I come here for some, you know, my restorative care plan or something very specific I'm trying to address. Yeah. But then I may be seeing other practitioners out in the community, and what I hear from them may not be consistent with what I hear from you. Right. So I would love a way to plug into this clinic more in a cost-effective way. So that's one of the reasons we did this. And the other thing really is the timeliness of it. A lot of you who maybe work in a big corporate environment, who have an opportunity in the next few months to enroll for benefits, you may be wanting to think about how does expense at the Livewell Clinic play into some of these enrollment decisions. And we're asked that question a lot. How can I make this more cost effective for my family? And then how does that work into what I invest in an HSA or a flex spending account or something like that?
Right.
So those are the key reasons why we're doing this.
Yeah.
When the time comes, when you either express interest or you get to the end of that restorative care plan, you'll be presented with an opportunity to think about different options that work well for your family. And we are at this point calling them membership plans. Really fancy names like Basic, Plus, and Premium. Right. So if you have something better, let us know.
Right.
But at the core of it really is, what do you need to create continuity of care for you, for your family, and maybe even give some access to care to other members of your dependents in your household as well. So at the core of it, there is this reevaluation or this staying out of trouble component. Every single one of these plans has some check-in opportunities through biannual panels. And depending on which level, you may actually, through like the premium membership level, have a little more sophisticated, a little more elaborate. I don't know how you would describe the difference between the elite and the basic panel.
We wanted to view it as a point to say we have a lot of patients that a lot of this was dictated by patients we see, and the reason we do these different levels is basically, patients, they do want a lot of the things that we do provide to be proactive and preventative. So that's why a lot of times you'll see that there's services, anything from IV nutrition therapy to health coaching and accountability, to even a new service that we're offering now that gives you complete access to the office at all times, just through the ease of your phone. So you're at home, your child has a rash, you don't want to know if you have to wait to take to the ER or quick care. You can do something as simple as send us a picture and we can give you some feedback. And this is all included in this monthly activities.
So some things that are included in all the plans, and you've alluded to some of them: access to the clinic in a new way. So that's through an app called Twine. We do have biannual panels in all of them. We also have in all three of the plans some additional office visits. Sometimes people really want to come here because a child has a cold or just something more routine and mundane. And again, they've always kind of wanted to know what we would do, but not really had access to doing that without having to think about the investment. So that is also included in all of these plans. In addition, there are two of the three that include IV therapy. And we are finding that interest in IV therapy is increasing in pretty drastic ways. We find that IV bay is full more often than it's not. So we took the liberty of including IV therapy in some capacity in two of the three, just out of really patient demand.
I want to reiterate the main reason we want to do this is I think it's our, if I can say, heart. We want to serve people the best we can. And I know personally, having families call and ask about their children or wanting to seek our help, but there's always costs involved with office visits and staff. And when that prevented people from coming here, I think that even personally was discouraging to me in a sense, because I think it just showed me and us that we could do more for the community and for families. And I think the way we did this, and that some people have taken advantage of already, is that when they basically say, what can I do this next coming year, or how can I stay on top of things, when we start doing some comparisons, and I think you might mention a few of these things, but in the end, it turns out to be almost, if you want to call, a pretty good value for you, and a good way for us to make sure that we're supporting you the best that we can, not just here's some lab work, here's some vitamins and pills, we'll see you later, but how can we stay ahead of the game. So I guess I just wanted to mention that because the outcome is good, but also the way I view it is, in the functional medicine world, it's not just as easy as saying I have XYZ condition, give me some pills, IV therapy, I'm healthy, I'm good, see you later. We're all on the journey for life, honestly. I think we live in a more toxic world and it's going to get worse. What we can do for ourselves to stay ahead of that, I know it's my hope that we can serve you that way, because I know that's what I would want for my own family.
And also the simplicity of it, the predictability of it. Lots of patients say, it'd be easier if I just knew what this was going to be on a monthly basis. And that's exactly the structure of the membership plans. It's a monthly payment that over the course of a year will include a certain set of benefits, and everybody knows what that monthly amount is going to be and all of the things that they can take advantage of within their plan of choice. And so that eliminates the, is today the right time financially to bring my kid in? You know what, it doesn't matter, because it doesn't matter when it can be 4 times in 1 month, or it can be 4 times over a year. And so that's the value that you're talking about too. So in short, the basic plan, with all of the services that are offered, the panels, now the basic one is not the one that includes IV therapy, and we can talk about benefits to that as people express interest, but it's a good check-in. It's kind of routine maintenance for the body, I guess.
Yeah.
So panels, it's office visits, it's access to supplements that we sell here at a discounted rate. Again, it's access to the clinic for questions, it's things like that. And then as you move through, it starts to incorporate IV therapy and then these more premium panels. Just the basic plan saves the individual member almost $500 on an annual basis.
Yeah.
And then again breaks that down in very predictable amounts.
Right.
And then the middle one somewhere in the neighborhood of $600, and then the premium one that really gets a little harder to determine, because actually in the premium membership we have some care included for dependents as well. So when people want to be able to bring in their children, we have kind of this more robust plan that gives them the option to do that. So we would love to talk to you about which plan might fit your needs and the needs of your family the best, and really give you something that's convenient and easy, cost effective, and really provides you an opportunity to be here whenever you'd like to be, as opposed to just within this more structured care plan we've been doing.
Right. Yeah. I know I'm pretty kind of personally excited. I know we see a lot of families here who have lots of kids, and I think that
including yours, by the way.
Including mine, that they've embraced us, and I think that gives me joy, and even our staff, a way to invest in you. So I really encourage people. I mean, the hope of this is just to say, kind of, we are your health coaching coaches, just like there's life coaches and there's business coaches. We want to be here with the health, because a lot of people that we work with know the good things they need to do. They just need maybe a plan and support. And if we can do that, I think we are fulfilling our job, and we can all celebrate together. So I don't know if you want to quick mention what they can do next to ask more questions.
Sure. Yeah.
And go from there.
We're absolutely prepared to start to interact with people and answer your questions. You can call the office. The staff has a really good high-level understanding of what's happening. But also, we're going to be scheduling appointments, just short 15-minute appointments, so that you can come in and visit with someone here, with me, and talk about what specifically you're looking for, and then determine which one of these plans might best suit your needs. And then we'll get you set up and ready to go, and you can start leveraging those benefits right away.
Yep, perfect. Yeah, I encourage you to call, just ask questions about what we're doing, and I know you'll be learning more about us soon as we get closer to the end of the year anyway, but wanted to share this with you quickly and get a start on that. So we thank you for your time, and we encourage you to talk soon.